Happy to hear that. So what can I do? Hello and welcome to Dr. Whisper's office. How are you today? Thank you, I'm doing fine. Is this your first time with us? May I have your name, please? Okay, let me check our system, okay? It's first time. So, Dr. Whispers requires that you answer a few questions before you go with her. Is that okay? Very good. Normally it takes about 10 minutes while Dr. Whispers finish with her other patient. Okay, you're here for a deep face examination and checkup treatment. Okay. Can you tell me what brought you here today in a specific? Okay. Have you seen a dermatologist before, or this is your first time visit with any dermatologist beside Dr. Whispers? First time at all? Okay. Now I see in your email that you have forwarded us your medical history with your first care practitioner. Okay. So that will be open for Dr. Whisper to check out. Okay. Do you have any medical conditions or allergies, especially skin allergies? It could be maybe like grass or soaps, detergents, shampoo, creams. Okay, thank you so much. Are you currently taking any medications either for your skin or other health issues? Even if it's just for headaches. Okay. You can tell me the brand or if you remember how the bottle was. Is it over the counter? Okay, thank you. Excuse me? Well, normally for first-time patients, Dr. Whispers takes around 40 to 50 minutes. Is that okay with you? Very well. Do you have a family history of skin conditions such as eczema, psoriasis, skin cancer? Okay, how about skin allergies in your family? Don't worry if you can thoroughly recall, if you happen to remember why you're with Dr. Whispers. It's okay, you can tell her. Okay. Have you had any major changes in your skin recently, like moles, discoloration, unusual rashes, pimples, or something that is not healing in your skin? In the past 2 months? Okay, thank you. Now, what specific skin concerns are you hoping to address today with Dr. Whispers? Let's say acne, rashes, wrinkles, pigmentation, maybe itchiness. Okay. How long have you been dealing with this issue? And has it worsened or improved over time? Mm-hmm. Okay. Okay, thank you. Have you tried any over-the-counter treatments or home remedies for this? Have they worked? Okay. In a scale of 1 to 5, 5 meaning that it completely cured, 0 being that it didn't work at all, how could you rate those home remedies? A little bit of relief with the sensation, but not curing it. Okay. What does your current skincare routine looks like? Talking about how you use maybe creams, soaps, anything that you use in your body and your face relating to skin. Yeah, such as moisturizers, creams, serums. Mm-hmm. Okay, do you recall the brands? Okay, thank you. And what is the frequency that you use these products? Is it daily, every other day? Okay, thank you. Very good. Now the next question will be, how often do you use sunscreen? It's okay, don't feel ashamed. That is something that is important for Dr. Whispers. And what SPF do you typically use for this? Okay. Do you have any specific concerns about the environmental factors like sun exposure, pollution, maybe stress affecting your skin, anything like that? Mm-hmm. Okay, how about sleep? Do you have a good night's sleep? How many hours do you typically sleep? Okay, thank you so much. And have you noticed any changes in your diet or your sleep patterns, your stress levels during this, let's say, about 2 months that you might feel it's connected to your skin condition or the issues that you're coming here today with Dr. Whispers? Mm-hmm. Okay. Thank you so much. I know that all these questions might feel like a little bit too much, but it's gonna give Dr. Whispers a clear map on how to help you with today's issue. Okay, so what are your expectations or goal for your skin health moving forward? You're trying to have, let's say, luminous skin, a skin without acne, skin that is looking more healthy, moisturized. And our last question would be, will you prefer a treatment plan that is more medical, lifestyle based, or a combination of both? Yeah, medical will be with creams or maybe pills or serums or other treatments that are medically based. Lifestyle based will be changes maybe in your diet, on how you manage stress, and the way that you eat, or a combination of both. Oh, combination. That's good. Okay, so Dr. Whisper is almost finished with her patient. I will be calling you in about a couple of minutes so you can move forward towards her. Now we have a waiting room right here on the side, and there you see a little table with snacks and beverages that you're free to take while you wait. Okay, thank you. I will be calling you once Dr. Whispers is ready for you. Thank you so much for the information. It will be of great help for her. Hello, I'm Dr. Whispers. Oh, wow. Yeah, I can actually see. Oh dear, please take a seat. Can I have your name? Yeah, I see that is quite severe. Are you in a lot of pain right now? Mostly discomfort. Okay, I'm gonna help you with that in a minute. Let me just check your medical information here. Okay, I see that you're a patient with us. I don't see any past history of issues with what is actually going with you. Can you talk about it? What happened? And if it was something sudden, please let me know. Okay. You were trying new products in your face? Oh, I see. An internet trend to remove freckles. What product do you use to do this? Oh no, dear. Okay. Yeah, that definitely burns your skin. You're not erasing your freckles, you're burning your skin with that, and in the process a few freckles get actually dissolved from it. So how is the discomfort going right now? Okay, when did it start? When did you do this trend? Early today. Okay, so it's quite early yet. Very well. Let's check you out. Are you wearing anything else beside the product? Oh, really? So there is a whole lot of chemicals in your face. Okay. Let me just check here. Okay. Does it hurt when I touch you? Like a burning sensation? Oh, I'm so sorry. I'm gonna try to be as gentle as possible here. Okay, let's use this. Okay, it's actually falling off, which is not a very good sign. Okay, let's see here. So you only apply it in your forehead area. No other areas were involved, right? Just here. Very well. So let's start first by trying to make you feel comfortable. So we are gonna numb the whole area. Can you tell me which areas in specific do you apply these products? Forehead only. Okay, so from here to here, or only this area? Okay, good. So first things first, making you feel comfortable. I don't want you to be in pain or discomfort. Okay. This is gonna help numb the area, okay? No. It's gonna sting a little bit because of the product that you have on, but it's gonna fade away quite fast, okay? I'm gonna be as gentle as I can, but I know it's quite uncomfortable. Now, don't worry, don't feel ashamed. It's something that can happen to a lot of people. Sometimes we follow these places with pages or people that we trust, and well, what works for others might not work for you. So I always say that if you have a skin problem, try to consult it with a professional first, because what you see on screens, what you see maybe in a TV show or a video on YouTube, TikTok, whatever, might work for the person that is trying it on and is showing it to you. But we all have different kind of skins. We all have different kind of issues in our skin. So what works for them might be harmful for us. So it's very important not to follow this kind of advice, even if it sounds good and they tell you that everybody can use it. You could be one in a million that it's not gonna work and it's gonna harm you, which is what happened here. Yeah, for some people that combination does work, but it's better to do it with a professional. So I do understand that you felt it was okay. Okay. Yeah, it seems that your skin is overreacting to the products and it's peeling. Yeah, it's like a chemical peeling. We use that for certain issues on the skin, but in your case, it's very dramatic. I know it scares you when you start feeling this. Okay, that should do it. Now you should start feeling your skin numbing and getting a little bit warm. It's normal. Then you're not gonna feel anything. So what I've been looking at is that we first need to extract all those toxins and then do a gentle exfoliation to remove the dead skin that is actually peeling in certain spots, like here and here. It's actually now peeling on itself, so we're gonna remove that. And to soothe your skin, to protect it, because it's gonna be very, very sensitive. I don't know, maybe a gentle mask is gonna help it. Let's see, I'm just trying to try not to touch too much to see your type of skin, but with how it is right now, it's very difficult. Do you know if you have mixed or dry skin, oily skin? It's kind of hard to see right now. Okay, we're gonna treat like a mixed type of skin. I don't see much dryness on the cheek areas, so that's a good hint that maybe you're a mixed skin. But it's quite sensitive. Okay. Let's see. Let's do a little testing here. Let me know if you can feel this, okay? How about this? And this? Can you feel this? Very good. Let's start by extracting all those chemicals that you have right now. We're gonna go with an organic serum here. This is quite great for this type of issues and for your type of skin, and that is ultra sensitive. We don't want to use more chemicals on you, so this is gonna be good. Okay, we're gonna soak your skin with this Actually, I'm going to protect your hair first. Okay. Even though it's harmless to the hair, we just want to protect it and not get it wet. Like that. And this to protect your clothing. Like that. Okay, good. So your skin might get a bit wet from this. I'm gonna use a kabuki brush for you. It's quite soft, so. And you get your skin soaking wet with this product. Okay. It might start dripping. Don't worry. Very, very gentle. How are you feeling now? More is? Yeah, without that sensation, it's much better. Okay, good. Let's leave it there. So it starts acting out. We're gonna take it out with just a tissue here. Very well. Okay, that looks good. Just wanna see how's the peeling going. Well, this is definitely not gonna take out your freckles, but at least you're gonna have new skin in this area. Yeah. After it's completely healed, that part of your face is gonna look like a baby's bottom. So smooth and soft. Yeah, it's like a chemical peeling, but it's very dangerous to do it outside of a professional look because it can go deep into your pores and burn you. So it was good that you came so early for treatment. I'm sure that you got scared with it, but it's very good that you came very, very early in the process. Sometimes this type of chemicals can go deep into your pores and burn you from the inside. So good for you. All right, well, let's try to dry it off. Good. Let's be very gentle with it. Okay, it's actually getting some of the dead skin cells here, but you still require the exfoliation. Okay. Now in your case, it didn't went too deep. It's just the external area, which is good. Okay. Looks good. Happy to say that you are out of any danger. It looks very bad, but don't worry. It's nothing that is going to be permanent or is going to give you any other kind of issues in the future. Very good. So let's work on your exfoliation. Just trying to assess what type we're going to be using on you. Want to be gentle, but it needs to be strong enough to remove all that skin. I think I'm gonna go with this. Okay, this brush is out of silicone. The bristles are quite smooth and soft, so it's gonna be a good option for this. Let's use some of this. Okay, now let me know if it feels too much for you. Are you okay with that? Yeah? Okay. I'm not turning it on because I don't want to create more pressure than is necessary. Must be very gentle with it. Let's clean it up. Okay, try not to move. Very good. Let's see if I can do level 1. Just this area is a bit harsh to remove it. Yeah, quite hard. Okay. Looks good. Let's go with this. I feel a bit cold, okay? I'm gonna give it a few minutes to be absorbed. Okay, it's quite red and very, very sensitive. Good thing that you have your numbing solution, so we have to work on layering this up so when the numbing cream runs its course, you don't feel that discomfort anymore. I think we're gonna have to go with light therapy and cold mist therapy too. Yeah, that should do the trick for it. Okay, let's go first with the light therapy. This light therapy is quite warm. Feels like a little bit of warm sun into your skin. And what it's gonna do is make your skin cells feel good enough to start producing and repairing itself, okay? But we have to cover your eyes. You can keep them closed, but still needs to be protected against this, okay? I put this spray, okay? Keep your eyes closed. Good. Very good. There we go. Let's try with this. Let me know if you feel something funny, like a stingy sensation, burning sensation. You shouldn't be feeling that at all, okay? Just warmth. That's all you should be feeling, okay? Nothing else. Anything funny, let me know immediately. Good. Yeah, this is actually like photosynthesis for plants. You are telling your cells that, hey, here's some food, start working. Okay. Actually, I can notice the redness getting more dissipated, so it's looking good. Happy to say that it's no sickles is gonna be left. Okay. Good. Let's leave it a little bit while I write down your prescription you're gonna be taking home. You're gonna have a couple of face lotions and some medication in case that you feel some discomfort or pain. I don't want you to be uncomfortable next. Okay. Okay, good. So you're gonna have a lotion for the morning and another one for the evening before going to bed. The one in the morning is very important. That's going to protect your skin against the sun because your skin is going to be quite sensitive. How do you feel about hats, umbrellas, parasols? Which one is more comfortable for you? Okay, because you're going to have to wear some protective layer with this lotion to protect you from the sun. So either a hat or an umbrella. No direct sun exposure for a week. Very, very important. and also for pain and discomfort that you might or might not feel. It depends on the person. It's gonna be a painkiller, very mild, nothing too strong. Okay, that should do it. Let's see how it's going. Okay, let's remove this. Quite nice, quite nice. Looks good. Let me just check with my light here. Okay, that looks very, very good. The redness has subsided. There's a little bit of swelling, but it's normal in this case. It's gonna go away now with the mist mask that we're gonna be taking. For you, I would say 5 to 8 minutes should be enough. This cold mist is just gonna be distilled water with a little bit of drops that we use, that you're gonna be taking at night to help produce your skin cells faster and stronger. I don't recommend you. It's gonna be on your whole face, so you might breathe in and might go out to your mouth. In the mouth, it's completely safe if it goes into your mouth, but it's a little bit sour if you taste it. So try to keep your mouth closed. And if it goes into your eyes, nothing will happen. Just do that, and it's completely fine. Nothing will go with that. Okay. So the steam is just gonna be here, and the mist is gonna go into your face. Your skin, your hair is protected. Your clothing too. But I'm gonna put a cap in your hair because it's gonna be quite wet. Okay. Like that. Okay. So let's work it out for, I would say 5 minutes should be enough, 5 to 8 minutes, and it's gonna feel quite good. I only recommend you not to take your phone out. You don't want water going into it. We have some magazines here for you in case you want to read them. It's okay if they wet, nothing will happen, but it's not like you're gonna be dripping, but it's mist. Okay, very good. So let me just set it here. I'm just gonna recommend you to look straight forward, try not to move too much. If you feel that it's too much, call me. You have a button right here, but I'm gonna come and check you in a bit. Very good. Let me just set it up here. The mist is quite cool. It's quite refreshing, but again, try to keep your mouth closed because it's quite sour if you try. Okay, so it's set up. Just look straight forward, and I'll be back in a minute. Okay, very good. There we go. I'll be back. Okay, how are we going? Good. Okay, let's turn this off. That should be enough. Let's take this off. This one too. Okay, very good. Now you're a bit wet. Let me just tap that out for you. Okay. How did it go? It's quite nice, huh? Very relaxing. Yeah, the mist is very, very subtle. You can even see it, but it feels great into the skin. Wow, that looks great. Redness is completely gone. You can feel that? Okay. How is the discomfort? Nothing? You don't feel anything at all? Oh, that's great. Yeah, I knew the mist is gonna help. It feels quite good to the touch. Nice. Let me just do that. Very well. So you can look at yourself. You have a mirror right here. Looks much better, isn't it? Yes. Well, you are now with one layer less of your skin, but in the good side, it's gonna feel great after a couple of weeks. It's gonna feel very soft and smooth, like a chemical peel, but a little bit immature and sometimes dangerous. So try not to do that again, and be aware that your skin is very sensitive, and if you try something new that is that aggressive, it might lead to something like this again. Okay, so I have your prescription here. You have your solution that you're going to be putting before going outside. Also, wear a hat or an umbrella. No direct contact with the sun, anything, for a week. And you're gonna leave that on for the full day, and then at night before going to bed with clean face, just soap and water, and it has to be neutral soap. Okay, no makeup removal. Also try not to use makeup if it's possible for a week. In the area in specific, you can put on like from here to here, that's okay, but not on this area. Then with clean face, just soap and water on this area. No makeup removal there, no makeup. Also, no sun protection there. What I'm giving you right now helps you with that, but it's medicated. And at night, you're going to be putting the same way as the ones in the day. All the instructions are in your prescription here. And you're going to be doing this for a whole week. In case that you feel any discomfort or pain in this area, take a capsule. We're going to bring you here for the pain. Once every 24 hours. Or depending on the pain that you have, if it's too painful, come to us. Okay, it shouldn't be too painful. But if you feel the pain a little bit, stinger a little bit more, take one every 12 hours. Okay, is there anything else I can do for you today? Very well, in case that you have questions or something comes up, please call us or send us a text. Very well, it was a pleasure. Please take care. Okay, bye-bye.